So hello students, and let us now understand the infratemporal fossa, a very important topic from MCQ point of view. Students, let us begin. Now, what is this fossa? This fossa where the muscle temporalis is located. What do you call this fossa as? Yes, the temporal fossa. Correct. That's a temporal fossa. What is this for the mandible? What is this for the mandible? Body. And what's this for the mandible? Ramus. And what's the junction known as angle? So that's the body, that's the ramus, and the junction is known as the angle of the mandible. Correct. We know this. Now we remove the ramus. We remove the ramus of the mandible and we go deep inside. There's another fossa. What do you call this fossa as? We remove the ramus of the mandible and we go deep inside. That's the infratemporal fossa. Infratemporal fossa. Are you able to follow this? Look, what is infratemporal fossa? Where is it located? Have a look at this now. Just one moment. Okay. So look at this slide. Now you tell me one thing. What is this now? What is this for the mandible? Body. And what is this going to be? The ramus of the mandible. So that's the body. That's the ramus of the mandible. That's the body of the mandible. And what is this junction known as angle of the mandible? That's the angle. Now we remove the ramus of the mandible. We come deep to the ramus and we come into a fossa which is known as the infratemporal fossa. Clear? So now suppose if I'm in the infratemporal fossa, students, if I'm within the infratemporal fossa, who's on the lateral side? Who's on the lateral side? The ramus of the mandible. Ramus of the mandible. Because we have removed the ramus and we have gone into the infratemporal fossa. So if you are in the infratemporal fossa, what is going to be the lateral boundary of the infratemporal fossa? That's the ramus of the mandible. Ramus of the mandible. And students, if you can tell me, look, one moment, have a look at this. If that's the ramus and that's the body of the mandible, this is the body, that's the ramus, that's the angle of the mandible. Can anyone tell me what is the muscle inserted here on the outer side of the angle of mandible? On outside, that's a masseter. Masseter. And same muscle, there's another muscle on the inner side, on the inner aspect of the angle of the mandible. So if I draw it like this, and if I draw it like this, it's on the inner aspect of the angle of the mandible. What is this? That's a medial pterygoid. That means, students, on the angle of the mandible, outside is going to be what? Masseter. On the inner side is going to be the medial pterygoid muscle. Medial pterygoid. So now if I'm in the infratemporal fossa, and now when I look laterally, what do I find there? The ramus along with the ramus, the angle along with the medial pterygoid muscle. The ramus, the angle along with the medial pterygoid muscle. Look at this slide. So what is this view? What is this that you're looking at? Just get oriented to this infratemporal fossa. Slightly difficult to understand, to get oriented to. So this, I'm in the infratemporal fossa and I'm looking laterally. So when I look laterally, what do I see? This is the ramus, that's the angle. And what is this muscle? That's the medial pterygoid. That's a medial pterygoid on the inner aspect of the angle of mandible. Where would the masseter be? On the outer aspect of the angle of mandible. Clear? So the lateral boundary of the infratemporal fossa would be formed by the ramus with the medial pterygoid. Perfect. Now, from the infratemporal fossa, if I look medial, if I look towards the medial side, what do I find? From the infratemporal fossa, if I look medially, what do I see? What is this bone? That's the maxilla. Correct? This bone is the maxilla. This is the maxilla bone. What is this? This is the medial pterygoid plate. Medial pterygoid plate. So that's the maxilla. That's the lateral pterygoid plate. Sorry. That's the lateral pterygoid plate. Lateral pterygoid plate. Clear? So maxilla, the lateral pterygoid plate. What is this fossa known as? What is this fossa known as? This is the Pterygopalatine Fossa. Pterygopalatine Fossa. So from the infratemporal fossa, if I look on the medial aspect, what do I find? I find the Pterygopalatine Fossa lying between the maxilla and the pterygoid plate. That's the Pterygopalatine Fossa. Following this, now in this Pterygopalatine Fossa, there's someone who's staying there. It's the house of someone. Any guesses? Look at this. In this Pterygopalatine fossa, what is this ganglion? That's the Pterygopalatine ganglion. We'll be seeing this later, students. What are these ganglions and what is its significance? We'll see that later. So I just want you to understand, I'm sitting in the infratemporal fossa. Who's on the lateral aspect? The ramus, the angle and the medial pterygoid. Who's on the medial side? The Pterygopalatine Fossa. Pterygopalatine Fossa. Perfect. Clear? Now, if I look up, what do I see? I see the base of the skull, right? I see the base of the skull. And which is that part of the skull which I see when I look up from the infratemporal fossa? Yes, which is that part of the skull? Have a look at this. Students, you tell me, what is this for the sphenoid? That's the lesser wing of sphenoid. That's the petrous part of temporal bone. And what is this area? That's the greater wing of sphenoid. Greater wing. So students, if I break this greater wing, or if I go down through this greater wing of sphenoid, I'm right into the infratemporal fossa. Are you following this? If I go down from this greater wing of sphenoid, I'm right inside the infratemporal fossa. And in this greater wing of sphenoid, can you see this foramen? What is this foramen in the greater wing of sphenoid? That's the foramen ovale. And behind the greater wing, I mean behind the foramen ovale, here, it's a small foramen here. Behind the foramen ovale, that's the foramen ovale, and behind the foramen ovale is a small foramen, that's the foramen spinosum. Foramen spinosum. That means if I'm in the infratemporal fossa, if I'm looking up, what do I find? The greater wing of sphenoid. I find two foramens here, the foramen ovale and the foramen spinosum. And what is the structure which gets out through the foramen ovale, students? The mandibular nerve. And that's exactly why when the mandibular nerve gets out through the foramen ovale from the cranial cavity, when it gets out, it's right in the infratemporal fossa. Perfect. And below the infratemporal fossa is open. It's open below. It is open. There's nothing to communicate with. Okay. Have a look at this. Have a look at this slide. Yeah, that's a greater wing of sphenoid here. That's a greater wing. So this is going to form the roof of infratemporal fossa. So students, like suppose if you have to draw this infratemporal fossa, if I have to draw this, how would I draw this? See, I would draw this like this. That's the base of the skull. Base of the skull. Okay. Now, if this is lateral and this is medial, lateral and medial, what do I draw here? That's the ramus of the mandible. Okay, that's the ramus of the mandible. And what is this muscle attached to the ramus here? What is this muscle? That's the medial pterygoid. Medial pterygoid. So when I look lateral, that's the ramus, that's the medial pterygoid. When I look on the medial aspect from the infratemporal fossa, what do I see here? I see the, how do I draw this? One moment. I'll just make a fossa here and I write this as the Pterygopalatine Fossa. That's the Pterygopalatine Fossa. Clear? So I label this as infratemporal fossa. Infratemporal fossa. Clear to all of you? Are you getting an idea? Roof is formed with the greater wing of sphenoid. On the lateral side is the ramus with the medial pterygoid. On the medial side is the Pterygopalatine fossa. Below it's open. It communicates. Clear? That's the Pterygopalatine fossa. I mean, that's the infratemporal fossa. And what are the contents of infratemporal fossa? Students, if you have to understand this contents, the moment we remove the ramus of the mandible, we find two muscles of mastication in the infratemporal fossa. Now, which are these muscles of mastication? One is this. This is outside. What's that? Temporalis. Correct. What is this muscle here on the angle, but outside? That's masseter. So these two muscles are outside the skull, right? Temporalis and masseter. Now, which are the other two muscles left? The other two muscles of mastication are the medial pterygoid and the lateral pterygoid. The medial and the lateral pterygoids. And where are these pterygoids located, students? These pterygoids are located right in the infratemporal fossa, right? So if I have to make this pterygoids, look, this medial and lateral pterygoids are located in the infratemporal fossa. So I write this as the pterygoids. Okay, this is the pterygoid muscle, the medial and the lateral pterygoid. But you know, when we remove the ramus of the mandible, we are not able to see the pterygoids. We directly don't see the pterygoids because on this pterygoids lies a venous plexus. There's a venous plexus which lies here. The name of the plexus is pterygoid venous plexus. Pterygoid venous plexus. Have a look at this. So where does the pterygoid venous plexus lie? Look, you tell me now. Students, you tell me now. What is this for the mandible? That's the body. And what's that? Ramus of the mandible. That's the angle. We remove the ramus. We remove the ramus. What is this? What is this? This is the infratemporal fossa. That's the infratemporal fossa. What is the first thing that we find in the infratemporal fossa? This plexus of veins. What is this plexus of veins known as? The pterygoid venous plexus. Pterygoid venous plexus. Now we remove this pterygoid venous plexus. What do we find deep to it? The pterygoids. And you know, when the pterygoids contract, all these veins are drained out of the blood. Pterygoids are also therefore known as peripheral heart. You know, one peripheral heart in the body, that's the soleus muscle in the lower limb, because it pumps blood upwards towards the heart. That's the first peripheral heart. The second peripheral heart in the body are the pterygoids, the medial and the lateral pterygoids. Why? Because when they contract, all the blood is drained from the veins. So pterygoids are also known as peripheral heart. Clear? So we remove the pterygoid venous plexus. Deep to the pterygoid venous plexus lies what? Lies the medial and the lateral pterygoids. There's a nerve which comes in the infratemporal fossa. What is this nerve coming in the infratemporal fossa? Any guesses? So these are the medial and lateral pterygoids. Just have a look at this. What is this? This muscle, that's the medial pterygoid. And what is this? Lateral pterygoid muscle. We'll see this pterygoid separately in the muscles of mastication. Now we are just discussing the infratemporal fossa. So those are the medial and the lateral pterygoid, students. And there's an artery here. Look at this slide. There's an artery here. Now, it's a terminal branch of, what is this artery here? That's the external carotid artery. The external carotid artery gives two terminal branches, one which goes straight up here. That's the superficial temporal. And the second artery goes deep to the ramus of the mandible, enters the infratemporal fossa. Yes, any guesses? That's the maxillary artery. Very good, very good. That's the maxillary artery. So one content of the infratemporal fossa is going to be the maxillary artery, and thus the nerve which comes in the infratemporal fossa, that's the mandibular nerve, which gets out through the foramen ovale, comes in the infratemporal fossa, and then gives branches. Now mandibular nerve is a separate topic altogether, students. So just to get you oriented to the infratemporal fossa. Are you getting this now, all of you? So once again, let me just tell you the infratemporal fossa. Yeah, that's the mandibular nerve. You can see this mandibular nerve getting out through the infratemporal fossa, giving branches in this fossa. Okay, so that's orientation for you about the infratemporal fossa, right? Look, once again, in short, I'll tell you, that's the body of the mandible, that's the ramus of the mandible, that's the temporal fossa. We remove the ramus and we are right inside the infratemporal fossa. So when I'm in the infratemporal fossa, I look laterally. What do I find? The ramus of the mandible and the medial pterygoid attached to the ankle. When I see medially, what do I find? The Pterygopalatine Fossa. And who stays in that fossa? The Pterygopalatine Ganglion. When I look up, what do I find? The greater wing of sphenoid with the two foramen ovale and foramen spinosum. Below this fossa is open. Okay, below this fossa is open. I hope this is clear to all of you. This is a diagrammatic representation. So that's are the pterygoids. So this is the venous plexus first here. That's a pterygoid venous plexus. Then you get this mandibular nerve, and you get the maxillary artery also. Mandibular nerve, and I'll write here maxillary artery. Clear to all of you? So what are the contents of infratemporal fossa? Superficial to deep. The one is the pterygoid venous plexus. Deep to the plexus are the pterygoids. On the pterygoids lies the mandibular nerve and the maxillary artery. Clear, students? I hope this infratemporal fossa is clear to all of you. Any doubts? Just one moment. Yes, students, any doubts you have? Any doubts about the infratemporal fossa? I hope all these things are clear to you. In case of doubts, do get back to me. We'll discuss the mandibular nerve as a separate topic. That's a very, very important MCQ topic. And we'll discuss the maxillary artery as a separate topic. Also, we'll discuss the muscles of mastication separately. Right, all the muscles of mastication. So just remember all this you put in the infratemporal fossa. Pterygoid venous plexus we have already discussed in the dangerous area of the face. You remember how the infection from the dangerous area goes to the cavernous sinus via the pterygoid venous plexus. So dangerous area to the facial vein, from the facial vein to the deep facial vein to the pterygoid venous plexus, and from the pterygoid venous plexus, the infection goes to the cavernous sinus through the emissary vein. I hope, students, all these things are clear to all of you. Thank you.